So when we talk about the NHS, I think it will be no surprise to anyone if I say that we know the NHS is in crisis. When you consider that actually it was created when Britain was facing its direst need after World War II, from scratch, it's kind of unacceptable. This is a political decision to have the NHS in the state it is in. So the real issue we're facing is that we have a government which is actually committed not to a publicly funded NHS, but to an NHS which actually, at least in part, is funded by the private health sector. It's an Americanisation of our health system, even though we know that the American system is probably one of the worst in the world, in fact, when it comes to meeting the needs of everyone. So if we look at the NHS now, we've got shortages of doctors, we've got shortages of nurses, we've got shortages of hospital beds. We've had 50% cuts, so half the number of beds in the last decade to what we used to have within our NHS. Our money is being spent on bureaucracy. Margaret Thatcher introduced the internal market into the NHS, and when she did that, the cost at the time of bureaucracy was 4%, the administrative costs. Now, thanks to the internal market, we're facing 18% of the overall budget for the NHS rising being spent on admin. It's absolutely ludicrous. The whole structure of the NHS is geared up to implementing policy decisions. For example, how many people know that under the Health and Care Act 2013, 49% of all NH hospital beds are actually supposed to go to the private sector. We've got hospital trusts who are targeted still to deliver that. It's absolutely shocking. We've got MPs in Parliament who've accepted funding from the private health sector, 60 in the last Parliament, before that 200 in Parliament and in the House of Lords. And I hate to say, we can't rely on Truss Labour nor the Conservatives to look after our healthcare. Keir Starmer and Wes Streeting have both taken funding from the private health sector. So how can we trust that they will leave our NHS alone? We need to revisit the structure of the NHS. It needs to be more accountable to the public. It needs to start serving us. We need to invest significantly more in the training of our doctors, of our nurses, putting back more hospital beds. Let's see more convalescent homes come back to address the bed blocking that we're getting with patients. I'm particularly concerned about those in need of acute care. We've lost 30 A&E departments across the country in the last decade, including our local hospital here in Grantham that was downgraded. That's put huge pressure on the existing A&E services. They are most at risk because actually they're the hardest to privately fund. They would never be profitable, so they've been targeted deliberately, because most people, when they think of the NHS, actually think, what would happen to me if I was critically ill? And they are the backbone of our NHS. The other big issue we know is around the GP practices. We need to review how they are set up, how they're funded. And it's ridiculous when we've got GPs not being employed locally because we're being told that it's not profitable for the new stakeholder GP practices to take on more staff. That is just crazy when we know there's a desperate need. We've got dentists now. Only 1 in 4 of us can access an NHS dentist. We've stopped preventative treatment of children. Labour's plan to force the GPs to work longer hours will not work. We will have more leave earlier. Their plan to have the dentist looking at children, preventative treatment, that's great in theory, but at the moment we're so desperately short of them. They're currently focusing on emergency treatment for patients. What happens to them if we follow that plan? It simply doesn't make sense. We've got to invest urgently